Give me a hug. Say go healthcare.
Go healthcare.
Get out of here.
I'm gonna get canceled. That sounded so fake. You should keep that.
I'm gonna keep it. Christopher McNaughton was sick. Not take a few days off sick. He had severe ulcerative colitis, arthritis, exhaustion, dangerous blood clots. At one point, he was going to the bathroom around 20 times. 20 times. He was trying to go to college, trying to have friends, trying to live. Eventually, a Mayo Clinic specialist tried something unusual. Two expensive medications at unusually high doses. And they worked. Christopher went from using the bathroom around 20 times a day to three or four. The bleeding stopped, he gained weight and his energy again. He was getting his life back. Then came the insurance problem. Christopher had, watch this, United Healthcare. At first, United paid. Then the claim starts sitting there, pending, 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 until more than $107,000 in claims were denied. United had an argument. The doses were much higher than FDA guideline. The company said reviewing the treatment was about safety and medical necessity. Christopher's family disagreed, so they fought. And eventually, they sued. The lawsuit gave them something most patients never get, a look behind the curtains. So, according to ProPublica, internal records show United employees discussing just how expensive Christopher had become. His medical bills were approaching $2 million a year. Golly. One doctor working with United reportedly warned that denying the treatment could put Christopher's health at risk. That assessment wasn't used in the final decision. Eventually, after Christopher's family fought, after Penn State got involved, and after litigations began, United Healthcare paid. Christopher got the medication. But the question remains, who gets to decide? Your doctor? Your insurance company? And what happens when they disagree? Because this happened years before America knew the name Luigi Mangione. December 4th, 2024, Manhattan, Brian Thompson, the CEO of United Healthcare, was walking towards his company investor conference. A gunman approached him from behind. Shots were fired. Thompson died 5 days later. Police arrested Luigi Mangione. And now, almost 2 years later, Mangione has admitted he did it. He admitted researching the conference, traveling to New York, bringing a weapon and shooting Brian Thompson. But Luigi did not plead guilty to federal murder. He pleaded guilty to two federal stalking charges resulting in death. The federal murder charge had already been thrown out over a legal issue. So New York still has a second degree murder case against him. And Mangione's lawyers are arguing the federal guilty plea could prevent that prosecution, under New York's double jeopardy protections. The courts will decide, but the legal fight isn't what makes this story extraordinary. It's what happened after Thompson was killed. People started telling their healthcare stories. denied claims, prescription problems, prior authorization fights, parents fighting insurers for their children, doctors fighting for patients, and some people started sympathizing with Luigi Mangione. And here came memes, fundraisers, supporters outside the court. Now, most Americans did not support him. A December 2024 Economist YouGov poll found about 20% of adults viewed Mangione favorably, while 43% viewed him unfavorably. But among adults under 30, 39% viewed him favorably. And people who had personally experienced insurance denials were more likely to view him in a positive light. That doesn't mean insurance denial causes support for Mangione, but it raises an important question. Why did this particular murder hit such a nerve? Here's what we know in 24. Healthcare.gov insurers were denied about 19% of in network claims, but not every denial represents medical necessity care being rejected. Some involve billing problems, some involve services that aren't covered, others involve missing authorizations. So those numbers need context. At the same time, in 2026, KFF survey found one third of insured adults said they had coverages denied for something their doctor prescribed within the previous 2 years, and two-thirds call insurance delays and denials a major problem. So United Healthcare says its own records is often misrepresented. Now, the company says it approves and pays about 90% of medical claims when they're first submitted. The insurers have a legitimate argument. Healthcare isn't unlimited. Not every treatment works. Not every treatment should be covered. Costs have to be controlled somehow, but that leaves us with a conflict. The insurance company helps decide what gets paid for, while also having a financial incentive to control how much it pays. That doesn't make every denial corrupt, but it makes transparency and accountability increasingly important. How much responsibility belongs to Brian Thompson, one might ask? After Thompson was killed, some people essentially argued that he had killed thousands through United Healthcare. We can't establish that as a fact. Thompson had enormous power as CEO, yes, but he wasn't the American healthcare system or hospitals, drug companies, insurers, employers, regulators, Congress, all that shapes the system. So instead of declaring Thompson personally responsible for every harmful outcome, because he is dead, the better question is, what decision and policy was he actually responsible for? That's where accountability should begin, and with evidence. Now, why do some people sympathize with Luigi Mangione? It may be you, may not. The strongest version of their argument isn't complicated. Patients can spend months fighting enormous corporations. While they're sick, insurance companies make billions, executives make millions. Congress has had decades to fix the problem in American healthcare. Republicans currently control Washington. Democrats, a few years back, controlled Washington. And many of the same companies remain. So some people looked at Thompson and saw the face of the system they already hated. I understand that anger, But here's where I draw the line. Mangione did decide Thompson was responsible. He decided his punishment and he carried it out. A vigilante. He was Batman. And this is important. Once we accept political violence against people we believe are harmful, we have to accept that our political opponents can use the same logic against us. That's not accountability. That's just more violence. This brings us back to Christopher McNaughton. So Christopher didn't shoot anybody. His family fought through the system. They called, they appealed, they involved Penn State, and went to court, and eventually United Healthcare paid. But look at what it took. It took doctors. It took determined. It took a determined family. It took a university. It took a lawyer, lawyers actually, a federal lawsuit. What happened to the patients that don't have all that? That's the part of the story I don't want us to lose. Mangione killed Brian. He admitted it. And I don't believe Thompson deserved to be executed on Manhattan sidewalks. I don't. But condemning Mangione doesn't answer the question that exists before he even pulled the trigger. When your doctor says you need something and your insurance company says you don't, who should have the power to decide? The answer isn't a man with a gun. It's a healthcare system where ordinary people have enough power and powerful institutions face enough accountability that a patient doesn't need money, lawyers, and a federal lawsuit just to be heard. Christopher McNaughton should never have needed Luigi Mangione to make America ask that question.